Hey, hey, hey! Val here with Hurst Review. Welcome into this segment of Hurst Review. Again, my name is Valerie. I am thrilled to be here with you. So I'll tell you what I want you to do. I want you to jump in that chat, say hi, say hey, or maybe just hit a key or a letter. It just lets me know that you can see me, you can hear me, and you are ready to go through this segment. You know, at Hurst Review, we love providing these little sessions with you. So if you ever have suggestions or different things, let us know. Get in the comments or direct message us on social media. So today, we're going to kick off with the NCLEX challenge question. But before we do, let's talk about that NCLEX test. How are you guys? Are you getting ready? Is graduation coming? I know it's exciting this time of year. You've got so many schools graduating April, May, June, July, and even August. So the light is on at the end of the tunnel, and we are so excited for you and happy to kind of help you or support you on your journey as you're getting ready to take and pass that NCLEX. So coming in, let's talk about the NCLEX. You know, the goal is pass the NCLEX the first time, and that's our specialty. That's what we want to help you do. But sometimes students don't know about Hurst, and they've taken the NCLEX, and maybe they're not successful. Well, we can help you too. So either way, if you're a first-time test taker or not, Hurst is ready to support your journey. But let's talk about if you're not successful. Do you see it on my screen? Let me know in the chat. Do you know what happens to your chance of passing if you're considered a repeat test taker? Think about that. Do you think it increases or do you think it decreases? What are you thinking? Decrease. You got it. Y'all, it's scary. To around 41%. Whoa. That is low. So we're excited to be able to help you on that journey to know that content. See, at Hurst, we are a comprehensive review, and we're going to start off with knowing that content, having practice questions, readiness exams, the workbook, the online account that you can go through, no matter which format you choose, to have the content you need, strategies you need, and support so you can pass. So here's what I want you to do. Hop in that chat again and give me one word when I say NCLEX. Like, what is one word that comes to your mind? Think about that. I mean, yes, the NCLEX is a safety test, right? Designed to protect the public from unsafe nurses. So safety, exactly. But were you thinking like anxiety? Were you thinking hard? Were you thinking expensive? Hey, I hear those all the time. But listen, when you know how the NCLEX sees you, when you have a proven plan for success, that starts to decrease anxiety and increase knowledge and increase your chance of passing and also being a safe practicing nurse, because that's the other goal, right? Pass the NCLEX, be a safe practicing nurse. So let's look at this last thing. The NCLEX test is not like anything you had in nursing school. That's where we come in. We are the NCLEX specialist. This is all we do, helping nursing students just like you succeed and pass that NCLEX the very first time. But I want to talk about this for a second. So hop in that chat. How many of you, let's say it's a priority question and you're in nursing school, right? And when you see that priority question, you take a breath and you go, okay, airway, breathing, circulation. How many of you think about that? I sure did in nursing school, and it was effective. It worked well. And it will work on some NCLEX questions, just not all. So see, at Hurst, we're going to have NCLEX specific strategies that are going to work with any NCLEX question. Another thing, we are about mastering the content, knowing the why, like why behind causes or why behind signs and symptoms. See, when you know why, well, you can apply. Sometimes in school, we might have memorized, whether it was abbreviations, medical terms, definitions, but that's short-term memory. So we're all about driving that content into your long-term memory so that when a question pops up, you're going to have that knowledge you need to walk yourself through. Speaking of questions, I would love to do a question with you. So what we're going to do is bring the question up on the screen. I'm going to go away for just a moment. I want you to think about what that option would be and put that answer in the chat. And when I start to see an answer or two populate, well, I'm going to come back on and we're going to walk through the question together. You ready? Go. All right, I'm back. Are you ready to do the question together? Well, let's read the question first. To reduce the risk of developing a complication following a balloon angioplasty, the nurse should implement which measures? Select all that apply. Now, if you were with us in the morning session, maybe you heard us talk about select all that apply. But if it's your first time, then let's start there. Those 4 bold words, select all that apply. They're bold on your screen, just like all throughout the Hurst accounts, because that's exactly how they look when it comes to NCLEX. Again, being the NCLEX experts, we're trying to mimic that experience for you when you're going through practice questions or readiness exams or even clinical judgment exercises. That helps, again, to decrease that anxiety. So what about those 4 words? How do you approach a select all that apply question? You ready? Well, the best way to approach it is read the stem of the question, look at each option provided, and treat it as a true or false question. Rereading that stem with every single option. Now, when it comes to select all that apply, especially in the extended select all that apply, you could have up to 10 options. So take your time. You have 5 hours to test. There's absolutely no rush. And go through each option and say, hey, is this true or false? Now, here's something I want to ask you. Are you excited about partial credit? I'm excited for you, but I do want you to know the rules of partial credit. So let's go there. When you get an option correct, well, credit's given. If you miss it, if you get it incorrect, whoosh, credit's taken away. So when it gets to the end, there are no ties. You've got to have more answers correct. Okay, so a good suggestion. If you've never heard of that before, or if you're unsure of exactly what it is, or if it could cause harm, you might not want to take that answer selection. Remember, we are always trying to think safety, keeping your client safe, you as the nurse safe, so make sure you're going with those safe options. All right, let's go back to this question. So rule number 1 when it comes to NCLEX questions, assume the worst. Assume the worst. Hey, put that in the chat. Assume the worst. Why do I say it that way? Because that's going to drive you to the safest response. You're always going to think safer when you assume the worst. Got it. Okay, what's next? Identify the problem. So we're going through, and this says looking for risk that could have developed due to a balloon angioplasty, right? So what is a balloon angioplasty? Hop in that chat. Tell me what you're thinking here. Well, this is when they could go in through the femoral artery, open up that good flow to get that good oxygenated blood going to the heart. That's what we're trying to do, right? Increase that oxygenated flow to the heart. Got it. So we know exactly what they're doing. Now, what do we need to do? We need to think safety. So what are we going to implement? What should we do? Or why would we need this? Those are things that start going through your mind, right? So let's come down, let's look at the options provided, and let's say, is it true that we would want to implement this, or is it false? Maybe it's contraindicated. So here we go. Looking at number 1, what did you say? True or false? Well, if we were going in to restore that good oxygenated blood flow to the heart, it would be a good thing to monitor cardiac rhythm. Definitely. We want to make sure that we've got a good rhythm coming in for our client. So number 1 is true. How you doing so far? Let's look at number 2. Assess the puncture site every 8 hours. Hey, hop in the chat. When someone has a balloon angioplasty, are they at risk for bleeding? What are you thinking? Just wire in, yes or no, make it easy. Yes. Okay, so let's go back and look at this. So I do agree with assessing the puncture site. I'm with you there. But every 8 hours, is that often enough? No, great job. No, we actually want to be assessing them maybe every 15 minutes initially for that first hour, then maybe move to every 30. And if they're stable, okay, maybe every hour after that. So puncture site every 8 hours, no, we're not waiting. That's just too long, and that could cause harm. So number 2, we're going to put a false. Let's look at option 3, monitor urinary output hourly. Hey, is that kind of going around with like good perfusion to the body? When the heart gets oxygenated and we're flowing good oxygenated blood and we're perfusing the body well? would we have good urinary output? Or if it's not, it might have a decline, right? So monitoring the urinary output hourly is key to make sure that we are perfusing our body adequately. And the kidneys are definitely included. So number 3 is true. Let's look at number 4. Prevent flexion of the affected leg. Well, y'all, tell me in the chat. When I flex, does that increase pressure to the area? What are you thinking? Yes. Okay. So do you want them flexing or would you prefer them extending and keeping everything straight? You got it. Hey, preventing flexion is good because if we flexed, that could apply more pressure to the area and that could lead to bleeding. So I definitely want them extended, which is preventing flexion. Number 4 is true. Let's look at the last one. Avoid lifting the buttocks off the bed. Hey, when the client lifts the buttocks off the bed, are they too also kind of encouraging pressure in that area, increasing pressure? Absolutely. And again, that could lead to bleeding. Remember, we want them lying flat. So number 5 is true. So for this select all that apply question, my true responses would be 1, 3, 4, 5. Are you ready for a good NCLEX tip? Do you know how the NCLEX sees you? Well, at Hurst, we talk about being a brand new nurse. A brand new nurse. Brand new nurses, again, worry about everything. They think safety, safety, safety. And that is what we call thinking NCLEX. Guys, I had so much fun with you today in this event, but I do want to invite you to come to future events. So to join any future event, you can follow us on social media. You can hit that like or follow on Instagram, on Facebook, on TikTok, on YouTube. You're going to be able to find these where you can sign up, you can get registered. Did you know if you sign up, you register, and you attend the event that you may be eligible for a giveaway? Absolutely. So you want to be sure you get registered to join the events. You can also go on the Hurst Review website, click free resources. And in the free resources that invite you to the events, did you know that we have a free trial so you can actually try Hurst before you buy? And we've even launched a new podcast called Nursing Navigator. So you can follow that on Spotify, on YouTube. We would love to have you join. And send us suggestions on things you might like us to talk about on that podcast. So in giving things away, Spirit, let's give away a promo code. Today's promo code is free 2025. You've attended an event, the code is yours all throughout 2025. So if you're not graduating right now, just bank that code. Have that code there and available for you, but definitely check out that free trial and join future free events. So this will take $40 off our in-stream. This is our live streaming. It's very similar to how we're doing right now. We've got a live instructor going through, hey, filling in the pages of the workbook because our workbook is fill in the blank. It's interactive. It's engaging. We also have Nail Plus, completely online. So at your pace, at your leisure, you work Hurst on your schedule. And look at this, Acid Base Essentials for $25 off, it only costs $30. So for $5, you are getting 4 different videos coming in to talk about acid base pathophysiology, looking at compensation, how to work through. Also, you've got printable worksheets and 60 mastery quiz questions, all for $5. So definitely check out the Essentials of Acid Base and check out our free trial at HurstReview.com. Thanks for joining me today. Had so much fun. We'll be back in the studio soon. Check out for future free events.